50 years ago, towns and cities had their hospital on the hill, and it was the centre of the health universe. But times have changed. People are living longer, and many people are living with long-term conditions such as diabetes, heart disease, and respiratory problems. Some population groups in geographic areas have poorer health than others. Hospital and GP services sometimes struggle to cope with the demand. Healthcare technology is always evolving. Citizens want to increase the input they have in their healthcare. Residents want health services as near as possible. We need to look at doing things differently. Neighbourhood healthcare homes is a new way of organising care outside of the hospital. Everyone goes to the GP clinic for their health needs, which makes them a coordinating central hub of healthcare. Your neighbourhood healthcare home. Some neighbourhood healthcare homes are linking up together into a network so that they can collaborate to provide a better service. Neighbourhood healthcare homes is building links with the team of services that look after you in the community. iwi providers, plunket nurses, hospice nurses, pharmacists, community health nurses, and other healthcare professionals, to create a well-connected and coordinated response. Linking up better with the hospital will also be a part of this. An important part of this change to neighbourhood healthcare homes is about including you in deciding what needs to be changed for the better. We want to talk with you, the patients and consumers of services, about the way it could work better for you. You are at the heart of this new way of working. Here are some examples of what it might look like in the future. Here's Anne-Marie. She knows she needs to schedule a checkup pretty soon, so she goes online and makes her an appointment. She also asks a quick question of her GP and checks up on her record. She has the app on her iPhone, and so when she's out of the area and has a health problem, she has a record of all her medications right there on her phone. Meet Joe. He is 44 and is a healthy builder. He doesn't go to the doctor much, he doesn't see the need, unless he's really unwell. While working one day, he cut his hand on a saw. He's unsure whether it needs to be stitched. Joe calls the health clinic. They ask him to send a photo of it through. The clinic tells Joe to put a couple of Steri-strips over it, keep it clean, and it'll be okay. It's also important to let them know if it gets sore or red. This is Mere, a newly diagnosed diabetic. She lives out in the country. She has been working with her iwi nurse to learn about managing her condition. When she is unsure, she emails or texts her nurse. Both the iwi nurse and her GP know what's happening, as they can see a shared record of her care. The doctor can see that she is working with the iwi nurse. Mere also likes to show her daughter, who is a nurse, what has been happening with her care, so together they can track her medical record through the patient portal. This is Jessie. She is 78 and quite unwell. Jessie smoked for many years and now has breathing problems. She goes to the health clinic regularly, and before her appointments, a nurse rings her and talks about the key things she wants to get out of the visit. The nurse arranges any blood tests or x-rays to be done before the visit so that the results can be included in the discussion. The doctor has scheduled enough time to get everything done that Jessie needs on this visit. She has a clear plan of how to manage her condition, and she knows exactly who is in the team of health professionals supporting her. Jessie's general practice has electronically referred her to a local support group for people with chronic lung disease, and the support group has let the practice know that Jessie is now participating. It is all coordinated, and Jessie is getting all the care and support available. These are all examples of how we need to be working to give you the services you need and use the resources we have most effectively. So, things are changing, and it'll take a little while to see the results, but the important thing is, this is about change with your needs in mind, so the system works better for everybody. Talk to your health team about their involvement in neighbourhood healthcare homes, and let them know what you think.